Hello everyone, I am Dr. Harshavardhan Ghorpade from DOVS Eye Institute, Fortis Hospital, Vashi, Navi Mumbai. Today I am going to give you a short information about what cataract is and what kind of surgeries are available for the same. So this is our eyeball. As you can see, it has got three parts. The front part is called as the cornea, the middle part where we have the lens, and the last part, which is the internal part, is called as retina. This is the nerve that goes to the brain. So the light first passes through the cornea, then through the lens, and then reaches and falls upon the retina. Sometimes as we grow old, the lens starts getting opaque. So instead of this clear lens, we start having something like, say, this, a gray lens or a white lens, and then the light gets obstructed here. This is called as cataract. When we do a surgery, we basically remove this lens and replace it with a clear lens, an artificial lens, which then focuses the light on the retina. This is the principle of the surgery. How do we remove this lens? In the past, we used to remove it manually, just like making a big incision, and the lens used to come out. However, nowadays we do micro incision cataract surgery, in which we remove the lens with a procedure called as phacoemulsification. Let's keep this here. So in phacoemulsification surgery, we do very small incision surgery, which is around 2.2 millimeters. There is a machine called as a phaco probe that goes inside and emulsifies or breaks the lens into small pieces, after which these lenses pieces are absorbed into the machine. This is the procedure. After that, we put an artificial lens, which is a folding lens. It goes inside and opens up. So that makes the surgery micro incision plus a sutureless. So we don't need a suture, because for such a small incision there is no need to put a suture or a stitch. Also, because it is done on an area which is not having any blood vessels, the surgery also becomes bloodless. So it is sutureless or stitchless, bloodless, as well as anesthesialess. Why anesthesialess? Because we don't need to give an injection also, neither we need to give a general anesthesia. A simple eye drop anesthetic is enough to do the surgery. It takes about 10 to 15 minutes, and the patient is back home after about 2 to 3 hours once he comes to the hospital. So the whole concept is to make the surgery as early, as fast as possible, and to get the patient out of the hospital as soon as possible, making it a very comfortable and pleasing experience. The patient does not need to put an iPad. He gets to see immediately within half an hour to 1 hour. When we remove the pad, the patient starts seeing everything quite well, and the maximum vision starts appearing from the next day onwards. Post-operatively, there is not much care to be taken. Basically, he needs to take care of his eyes in terms of putting water, so no head wash for at least 5 to 7 days. He can do everything else. He can watch TV, watch his mobile, or go to and use his computer. I would say going out for a walk should be after 5 days at least. 5 days he should stay at home because of the dust and other chances of infection. In terms of complications, this surgery has the least complication. It is one of the most successful surgeries. Even then, there can be complications which need to be managed, and they can be managed. It could be a bleed inside the eye, it could be infection, it could be retinal detachment, it could be increase in the eye pressure. So these are very rare complications, so we don't really pay much attention to it, but of course if they happen, we can manage them. So overall, this is excellent surgery. It's a very good surgery. And in terms of lenses, I would say we have different types of lenses, like monofocal, which focuses for distance or near, multifocal, which focuses for distance and near, and toric lenses or cylindrical lenses, which are used for patients with high cylindrical powers. Usually we try to put multifocal lenses so that the patient becomes independent of glasses. However, not every patient is suitable for the same, and in those cases monofocals are preferred. Monofocals give in fact better kind of sharpness of vision than a multifocal, so many people also prefer monofocals. Toric, of course, is a lens which we use if the patient has a high cylindrical and we try to get rid of a cylindrical power. So thank you very much for patient listening. This is all about, in short, about cataract surgery. If you need to know more about it, you can visit us at DOVS Eye Institute, Fortis Vashi, or you can come to our outreach clinic at Saroj Specialty Eye Clinic in Vashi, Navi Mumbai, or you can visit our website dovs.in. Thank you so much.